Module 6, Treatment Goals.
I think it's very important to establish treatment goals with my patients. This is actually a new concept for most of them when they come to see me. And they said, well, the other person just basically said, well, I hope you get better kind of deal. I explained to them that basically, though we don't have the cure, we have ways of controlling it. So I am expecting that within 3 to 6 months that I should be able to make their psoriasis very significantly better. If I'm not achieving that goal, and they're not achieving that goal, then I'm telling them we're going to then potentially change things. We may add another drug to the drug that they're already on. I tend to treat patients fairly aggressively because I want to control this disease, I want to decrease their comorbidities, and I want to stop the patient's suffering. The goal that I look at in terms of treating for patients is something that I call PASI 75. So PASI 75 is really something that the FDA and Health Canada looks for in the clinical trials. But it means basically, have I been able to decrease the patient's disease by at least 75%? I'm certainly looking even higher than that now, hoping that I can completely eliminate all the lesions that the patient has, alleviate their suffering that they're having from their psoriasis. I think in the present times, patients have become more empowered with the use of the internet and educational materials that are being produced and patients have access to. They certainly know more about the disease. It's not uncommon for me to say patients that maybe are too educated. They've actually gone onto the internet. They come with a number of different questions about different things, and some of them are right or wrong. Some of them they've gone on to the right internet sources and got great information. Sometimes they've got information that is kind of completely bogus. And then I have to sort through that with them. And so I think they're empowered. They want to be part of the equation. And that's what as part of my goal is to treat them as part of the team member, if you would, that we together are going to make their psoriasis better.